We're going to be talking about keeping children and adults safe in motor vehicles. Passenger safety is so important. It is vital because crashes are a leading cause of death for children between the ages of 1 and 13 in the U.S. In 2022, 756 children died in crashes. 46% of those were unrestrained. We do not know if the other 54% were properly restrained or not. What we do know is that when drivers didn't wear their restraints, 68% of children also went unrestrained. This statistic shows that many child passenger injuries and deaths are completely preventable. Safety need is you. Driving a car is likely the most dangerous thing you do in your everyday life. Speeding, distracted driving, impaired driving, vehicle sizes are all increasing in our communities, even if you drive safely. So encourage safe driving behaviors by displaying them yourself. Stay off your phone, don't let yourself get distracted, and buckle up every trip, every time. Seats have labels that are standard throughout the industry. Always read and understand car seat labels before use. These include height and weight limits, manufacture date, lower anchor and seatbelt routings, and compliance with U.S. regulations. Some even include an expiration date. Please pause this video to check your car seat's labels. Not all car seats are legal for use in the U.S. Some are unsafe or counterfeit imitations intended to mislead consumers. They often appear as a well-known brand, but are made with subpar materials that break during collisions, and they have no crash testing. View your labels for model name, model number, manufacture date, height and weight limits, warning labels, and other regulatory compliance indicators. Verify that your car seat has all essential parts, such as the chest clip and a 5-point harness, noting the strap width should be 1.5 inches. Verify that your car seat or base has attached lower anchors and a seatbelt routing. Examine the manual for detailed English instructions, noting any misspellings. And make sure your car seat included a registration card for any potential recalls. System stands for Lower Anchors and Tethers for Children. Shown below are common lower anchors, as well as the lower anchor attachment in the vehicle. Also shown are a top tether on the car seat and top tether attachments in your vehicle. Avoid common errors. Aftermarket products are any product that is sold separately from your car seat. These include cushions, shoulder pads, headrests, pillows, and other comfort devices. Weather protection can fall over the child's face or prevent adequate airflow. Any of these items can change the fit, placement, and tightness of the harness, which can lead to injury or death. Toys and mirrors are potential choking and strangulation hazards. They can also become a projectile in a collision. Be aware that there are no federal safety standards, thus crash tested and 2 FMVSS standards are misleading. We see is chest clip placement. Where do you think the chest clip should go? In the yellow stripe, the red, or the blue? Clip should go at the armpit level or red line. This ensures that the straps stay on your child's shoulders for the duration of the car ride and in the event of a crash. If the chest clip is too low, the harness can slide around the body and the child can come out of the car seat. If the chest clip is too high, it can cause breathing issues or be uncomfortable, leading to older children lowering it too far down. How do you know if the harness is tight enough? You should not be able to pinch slack at the shoulders. The harness should be flat and straight over the stomach between the chest clip and the crotch buckle. And the harness should be snug over the hips with no slack. Where should the shoulder straps go when rear facing and when forward facing? When rear facing, the shoulder straps should wrap behind the shoulders like a backpack. When forward facing, the strap should go above the shoulder towards the ears. The car seat's recline indicator. Car seats need to be at the proper recline to keep the child's airway open and to prevent slouching, which can lead to injuries in a collision. Installation tips. Verify the car seat moves less than 1 inch or 2.5 centimeters side to side and front to back at the belt path. That is where the car seat is buckled in. The top of the rear-facing car seat will move more as it is not connected to anything. This is a good thing during a crash. Use the lower anchors or the seat belt, not both. Keep in mind that lower anchors have a weight limit listed on the side of your car seat. Make sure the webbing of the lower anchors or seat belt is not twisted. Ensure the lower anchors are right side up. When forward facing, use the top tether to prevent head and neck injuries. Make sure the angle is correct per your indicator. Use lower anchors for booster seats that allow them, or buckle in the booster seat when not in use to prevent it from becoming a projectile during a collision. Transitioning to the next stage too soon. When children hit milestones, we get excited, especially if they meet them early. Car seat safety is the opposite though. We want our children to stay in each stage for as long as possible to keep them as safe as possible. Using an age and size appropriate car seat or booster seat can reduce serious and fatal injuries by up to 80%. Every step up is a step down in safety. To the next stage, regularly check your child's height and weight. When they reach the height limit, time for a different seat, not before. When they reach the weight limit, time for a different seat, not before. It is whichever one they reach first. They only need to outgrow one limit, not both. Do not transition before the height or weight limit are reached. The American Academy of Pediatrics, the Center for Disease Control, and the National Highway Transportation Safety Association all recommend staying in each stage until the height or weight limit is reached. A study by the Swedish National Road and Transport Research Institute, rear-facing car seats reduce serious injuries by 92%. During 30-mile-an-hour collisions, children who are rear-facing only have 50 kilograms of force on their necks, whereas forward-facing children have 300 kilograms of force on their necks. They have fully developed bones, including their vertebrae. At birth, each vertebrae is 3 separate bones held together by cartilage. That cartilage can stretch up to 2 inches. A quarter-inch stretch can rupture the spinal cord, resulting in paralysis or death. Vertebrae are not fully formed until between 4 and 6 years old. Children do not have fully formed bones. Their bodies are in very different proportion than that of adults. A 9-month-old baby's head comprises 25% of their total weight. An adult's head only comprises 7 to 8%. A 6-year-old's head, roughly 10 to 12% of their total body weight. Seats and commonly asked questions. The question we get asked a lot is, what is the best seat? The best seat is the one that fits the vehicle, the child's age, weight, height, and developmental level, and is the one that the parent or caregiver can confidently and correctly use every time. Categories of car seats: rear-facing, forward-facing, and booster seat. Rear-facing car seats are comprised of rear-facing only, convertible, all-in-one, 4-in-1, and 3-in-1 seats. Forward-facing car seats include convertible, all-in-one, 4-in-1, 3-in-1, and combination seats. Booster seats include all-in-one, 4-in-1, combination seats, high back, and no back boosters. As you can see, there are many overlaps with the car seats and the stages. For feet to touch the back of the seat? Yes. It is perfectly safe for feet to touch the back of the seat. When rear facing, we do not see leg injuries, even when the legs are long. Children can cross their legs or put them on the back of the seat. We do not want to transition to forward facing too early due to spinal development. We see more head, neck, spine, and leg injuries when forward facing. If your child is safe in a booster seat, make sure that your children's ears are below the top of the headrest to prevent neck injuries. The shoulder belt is positioned across the torso and sits above the shoulders in the shoulder belt guide, if available. The lap belt is low and flat across the child's hips, touching the top of the thighs. This is how your child needs to sit in a booster seat to ensure their safety and comfort. Okay to move to an adult seatbelt only. Ride safely without a booster seat when all 5 of the following criteria are met. The child's back is against the back of the vehicle seat. Their knees are bent at the edge of the seat. Their lap belt is low across the hips and thighs, and the shoulder belt is across the mid-shoulder. Their feet rest comfortably on the floor. Those first 4 show that the child fits correctly. Step 5 is behavioral. Your child must sit properly for the duration of the ride. That means no slouching, playing with the seatbelt, or laying down. Be sure to check your local laws as well. Keep in mind, law is the bare minimum you do to not get a ticket. It is not always the safest way to travel in a car. What if my child unbuckles during travel? Identify the root cause, their age, their developmental stage, sensory issues, special needs, or discomfort with the car seat itself. Utilize positive reinforcement. Encourage and reward your child for staying buckled during trips, promoting safe behavior. For children in 5-point harnesses, you can button a shirt up backwards over their harness. For children in booster seats, consider going back to a 5-point harness. Some car seats are also easier to unbuckle than others. If your child has special needs or sensory issues, you should talk to your occupational therapist. By understanding your child's needs and implementing these strategies, you can help ensure a safer travel experience for all your family. Children are always safest when seated in the back seat of any motor vehicle. To sit in the front seat, children should be at least 13 years old, unless back seats are all taken by other children. Rear-facing car seats should never be placed in front of an active airbag. Be sure to check your local laws as well. Again, laws are the bare minimum. To not get a ticket, they are not always the safest way to travel in a vehicle. Used car seats safe? Yes. Used car seats are safe if you know the history of the seat. It has not been in a crash or a recall. It is not expired. It is not missing any labels. And it has been cleaned according to the manufacturer's guidelines. Crash, follow the manufacturer's guidelines. After a moderate or severe crash, you need to replace your car seat. NHTSA has a guideline on which crashes are minor and which are not. Dispose of any car seat or booster seat. You can recycle it, trade it in at participating stores' trade-in events, or you can throw it in the garbage. If you throw it in the garbage, you must cut all webbing and fabric, label the seat "Do Not Use" and "No Use Are." If possible, place the parts in different trash containers. These steps will help prevent endangering a child's life by reducing unintended use. Are safer than personal vehicles. Fatality rates for car occupants are 23 times higher than for bus and train occupants. Infants are safest when properly secured in a carrier or a baby-wearing device. If using the carrier, place it on the floor to prevent falls. Toddlers and older children are safest in their own seat. From the start of Denver's Vision Zero in 2017 up until this recording, there have been 0 fatalities of bus or train occupants, compared to the over 300 personal vehicle occupant deaths in the same time frame. During pregnancy. Why is proper seatbelt use during pregnancy so important? More children die before birth from vehicle crashes than they do from birth to 13 combined. These numbers only account for miscarriages that are reported. In reality, the number is probably even higher. Proper seatbelt use can reduce adverse fetal outcomes by 84%. A child is at a 17 times higher risk of becoming a traffic fatality before they are born than when they are in a car seat. Correctly during pregnancy, position the shoulder belt diagonally across your chest and collarbone and around the side of your belly. Place the lap belt across your hips, below your belly. Position the seat as far back as possible to maximize space between your belly and the steering wheel while maintaining safe access to the pedals. Tilt the steering wheel so the airbag points towards your chest, avoiding your belly and face. Try to maintain at least a 10-inch space between your chest and the airbag. Seatbelt adjuster? No. Seatbelt adjusters are not recommended as there are no crash safety standards. After a crash, seek immediate medical care, even if the crash was mild. Most miscarriages caused by collisions are a result of the placenta detaching from the uterus wall. Dress them in a single layer only. Once they are buckled in, tuck the blanket around them to prevent them from pulling it over their face and to ensure their safety and comfort. For toddlers, big kids, and adults, wear 1 or 2 thin layers, then cover them with blankets or a backward coat. Avoid puffy coats or bulky items, as these can compress in a collision, causing injuries and fatalities. Coats or snowsuits safe? No. Low-speed rear-end collision simulations of 10 miles per hour showed the lap belt cutting deep into the stomach on both adults and children when they were wearing winter gear, despite correct seatbelt usage. There are demonstrations. For resources, pause the next. You have taken the time to learn this life-saving information and hope that you share with friends and family. Remember to wear your seatbelt, avoid distractions, and encourage safe driving behaviors. Thank you.